As the numbers of Arkansans on ventilators reach an all-time high, medical centers are continuing to closely watch their ICU beds as the surge continues. Katrin Asaf checked in with Little Rock hospitals on where they stand. She's live at UAMS, and Katrin, it seems like we have a few more beds than we did this time last week.
Yeah, Donna, well, according to the governor, we do. Governor Asa Hutchinson tweeting earlier today that hospitals are slowly starting to see more open beds between additional ICU and surge capacity. But even with the addition of these open rooms, there's still the concern, and it's not revolving around space. It more has to do with staff. It feels like a never-ending math problem, the number of open beds related to COVID cases, a balancing act Little Rock hospitals have faced for a year.
It's really just a numbers issue for us.
Dr. Stepi Metse with UAMS is one of those working to solve the equation. But with COVID cases spiking, hospitals have had to adjust.
Take beds that are currently used for different reasons and appropriate them for surge capacity.
Tuesday, Governor Asa Hutchinson took a look at the state's open beds. ICU capacity is up by 17, and Arkansas now has a surge capacity of almost 700, beds repurposed to meet demand. Baptist Health has added 87 beds in their centers, with plans to up that by 70. As for UAMS, their limit is 144, with 66 COVID patients currently in their care. But the severity of the cases,
about a third of them are in an ICU,
is what's concerning, and physical beds aren't the issue.
It's not the space, it's the staffing.
The national shortage of healthcare workers is the major roadblock, with the issue of keeping the hospital staffed without overworking nurses.
Rethinking the staffing ratios, doing more team-based care.
But with hospitalizations reaching all-time highs, the best medical centers can do is continue to watch and make adjustments one day at a time. Now, Dr. Mete says the best thing you can do if you want to help healthcare workers and hospitals is simply to stay healthy. He adds that getting vaccinated, washing your hands, masking up, and social distancing is the easiest way to do that. And he also adds that we're all in the same boat, so if we want to turn the tide on COVID, we're going to all have to work together. Reporting at UAMS, I'm Katrin Asaf. Donna.
All right, Katrin.